Pulmonary hypertension is an cardiovascular disease. Look at these pictures, shows that normal heart and pulmonary hypertension heart, CT findings, MRI, angiogram findings, and echocardiogram. Look at this. Detail going on. Introduction. Pulmonary hypertension is a progressive condition characterized by high blood pressure in the pulmonary arteries, which transport blood from the right side of the heart to the lungs. This elevated pressure forces the heart to work harder to pump blood through the lungs, leading to potential heart failure over time if untreated. Definition. Pulmonary hypertension is a condition characterized by high blood pressure in the arteries of the lungs, causing the right side of the heart to work hard to pump blood. This increased pressure can lead to symptoms like shortness of breath, fatigue, and eventually heart failure if untreated. Types. The World Health Organization classified PH into 5 major groups based on underlying causes and pathology. Group 1, Pulmonary Arterial Hypertension (PHA), affects arteries in the lungs, often idiopathic or due to conditions like connective tissue disease. Group 2, PH due to left heart disease, most common type related to heart failure or valve diseases. Group 3, PH associated with lung diseases, hypoxia caused by COPD, intestinal lung disease or sleep apnea. Group 4, chronic thromboembolic PHC, caused by blood clots in the lungs. Group 5, PH with unclear or multifactorial mechanisms, includes hematologic, systemic, metabolic disorders or other unknown causes. Causes: 1. Idiopathic, unknown origin. 2. Genetic predisposition, mutation in DMPR2 gene. 3. Connective tissue diseases. scleroderma, lupus. 4. Liver diseases, cirrhosis. 5. Congenital heart disease. 6. Chronic lung diseases, COPD, sleep apnea. 7. Left heart disease. 8. Thromboembolic disease, pulmonary embolism. 9. Drug induced use of certain appetite suppressants or illicit drugs. Risk factors. 1. Family history of PH or certain genetic mutations. 2. Gender, more common in females. 3. Age. PAH typically develops in people between 20 to 60 years. 2. Lifestyle factors, drug use, example methamphetamine. 5. Underlying conditions, left heart disease, connective tissue diseases, or chronic lung diseases. Complications. 1. Right heart failure due to increased workload on the right ventricle. 2. Arrhythmias, irregular heartbeats which may be life-threatening. 3. Hemoptysis, coughing up blood which can occur due to ruptured blood vessels. 4. Thromboembolism, blood clots in the lungs. Pathophysiology. PH begins with narrowing, obstruction or damage to the pulmonary arteries, leading to increased resistance to blood flow. This triggers structural changes in the vessel walls, including intimal thickening, medial hypertrophy, and in severe cases, plexiform lesions. Increased resistance causes pressure buildup, which strains the right ventricle, eventually leading to right ventricular hypertrophy, dilatation, and potentially right heart failure. Step-by-step pathophysiology of pulmonary hypertension. 1. Initial triggers. 2. Vasoconstriction of pulmonary arteries. 3. Vascular remodeling. The following changes occur in the vessels walls: initial thickening, medial hypertrophy, advanced fibrosis. These changes make the blood vessels stiffer, less elastic, and more resistant to blood flow. 4. Formation of plexiform lesions. 5. Increased pulmonary vascular resistance, PVR. 6. Right ventricular hypertrophy. 7. Right ventricular dilatation and failure. 8. Systemic consequences of right heart failure. As the right heart failure, blood back up to the systemic circulation causing symptoms like edema, swelling in the legs as it is fluid in the abdomen and hepatomegaly, enlarged liver, reduced blood flow to the lungs also limits oxygenation. Exacerbating symptoms of fatigue, breathlessness and cyanosis, bluish skin. This sequence of changes ultimately makes pulmonary hypertension a progressive and debilitating disease, which without treatment can lead to severe complications and significantly impact quality of life and survival. Signs and symptoms. Pulmonary hypertension often starts with mild, non-specific symptoms, but progressively worsens as the condition advances. Common signs and symptoms include 1. Shortness of breath, dyspnea. 2. Fatigue and weakness. 3. Chest pain and pressure. 4. Dizziness or lightheadedness. 5. Cyanosis. 6. Palpitations. 7. Swelling, edema. 8. Enlarged neck veins, jugular veins, distension. 9. Reduced exercise capacity. 10. Coughing and wheezing. Diagnosis. 1. Echocardiogram, initial non-invasive test showing right ventricular function and pressure estimates. 2. Right heart catheterization confirms the diagnosis by measuring pulmonary artery pressure. 3. Pulmonary function test assesses underlying lung disease. 4. CT MRI scan visualizes lung structures and identifies other potential causes. 5. Blood tests rule out associated conditions such as connective tissue disease. 6. Exercise testing evaluate exercise capacity. Nursing diagnosis. 1. Impaired gas exchange related to ventilation perfusion imbalance. 2. Activity intolerance due to fatigue and dyspnea. 3. Anxiety related to chronic illness and shortness of breath. 4. Decreased cardiac output related to increased pulmonary vascular resistance. Management. Medical and nursing management of pulmonary hypertension. First, medical management. 1. Medications. Vasodilators, endothelial receptor antagonist ERAs. Phosphodiesterase 5 PDE5 inhibitors, calcium channel blockers, anticoagulants, diuretics, oxygen therapy. 2. Lifestyle and self-care modifications, dietary modification, physical activity, smoking cessation and avoidance of toxins. 3. Surgical interventions, arterial septectomy, lung transplantation. 4. Patient education and psychosocial support. Nursing management. 1. Assessment and monitoring, vital signs, edema and weight, heart and lung sounds. 2. Oxygen therapy management. 3. Medication administration and patient education. Administer medications, educate on medication compliance, monitor for adverse effects. 4. Symptom management and patient support, manage dyspnea and fatigue, address anxiety and emotional distress. 5. Preventing complications, monitor for signs of heart failure, avoid over extraction, prevent infections. 6. Patient education on lifestyle modification. Treatment. 1. Medications, vasodilators, dilate blood vessels in the lungs. 2. Endothelial receptor antagonists, reduced blood vessel constriction. 3. Phosphodiesterase 5 inhibitors, improves blood flow by dilating pulmonary arteries. 4. Calcium channel blockers, sometimes effective in specific patients. 5. Diuretics, reduces fluid overload, decreasing pressure on the heart. 6. Anticoagulants, prevent blood clots in pulmonary arteries. 7. Oxygen therapy, especially beneficial in cases associated with hypoxia. 8. Surgical options, including arterial septostomy, creating a shot to relieve right heart pressure and lung or heart lung transplantation for advanced cases. Psychosocial medicine. Here are 5 types of social medicines related to the holistic care and well-being of patients. Essentials: those with chronic conditions like pulmonary hypertension. 1. Psychosocial counseling. 2. Support groups and peer supports. 3. Social work services. 4. Rehabilitation and occupational therapy. 5. Health education programs. The social medicines emphasizes treating the patient holistically by addressing not only physical symptoms but also the social, emotional, and practical challenges of chronic illness. Prevention. 1. Manage risk factors such as treating underlying heart or lung diseases, controlling blood pressure and avoiding smoking. 2. Regular checkups for those at risk, especially with family history or known genetic mutations. 3. Avoid medications known to increase pH risk without medical guidance. In conclusion, pulmonary hypertension is a serious progressive condition requiring comprehensive care and early intervention. Although not curable, advancements in therapies and personalized management approaches enable symptoms control and improve quality of life for many patients. Thank you. Have a nice day.